Welcome to our second module, Applications of Direct Neurofeedback. In this unit, we'll begin to familiarize ourselves with some of the symptoms. Direct neurofeedback can assist clients with anxiety, depression, the after effects of traumatic brain injuries, post-traumatic stress disorder, addiction, attention deficit disorder, and a host of other complaints. Although each of these conditions stem from very different causes, they all have one important characteristic in common. They each involve a brain stuck in a dysfunctional pattern. As we reviewed in Module 1, direct neurofeedback involves disrupting that stuck pattern using a signal sent from an EEG console. It's important to understand that no matter what the client's symptom, the ultimate goal remains to use the EEG to create that disruption and, in doing so, allow their brain a chance to reset, repair, and reoptimize itself. There isn't an anxiety setting, there isn't a depression protocol. Amazingly, a very similar protocol is used no matter what the client's symptom may be. While each person's brain is unique, each brain wants to function efficiently. So each individual brain will work out the best way to rework itself in its own pathways without any conscious effort from the client. As a result, your experience operating the EEG machine will feel largely the same from client to client, no matter what the client's symptoms are. While the work on the EEG console will not vary much client to client, your interactions with those clients will. Each client's symptoms will require you to ask slightly different questions and observe slightly different details about the things your clients say and the manners in which they behave. The types of questions we ask our clients during our sessions and the behaviors we can observe are a crucial component of understanding, evaluating, and tracking the progress of those clients. It also helps us to coach them toward identifying their own progress, which is always the strongest way for them to feel the effects for themselves. Over the next 3 videos, we'll be familiarizing ourselves with the more common symptoms that can lead a client to seek assistance. First will be our behavioral group. We'll be taking a brief look at symptoms such as anxiety, post-traumatic stress disorder, and addiction. Second will be our cognitive grouping. This will include ADD, ADHD, and autism spectrum disorder. It can also help countless other symptoms like depression, traumatic brain injuries, chronic pain, and a host of less common but applicable symptoms. Now, it's worth noting that a client doesn't necessarily have to have a specific symptom or a complaint to seek or be aided by direct neurofeedback. It is both acceptable and common for a client to simply be seeking the benefits without having voiced a specific complaint. That said, for the purposes of the next few videos in this module, we'll take a closer look at groupings of these symptoms to get to better know them, some of their common signs, how to assess them, and how to scale them so that they can be tracked. Finally, we'll look at how to manage your clients' expectations, from the intake through their first session and into each of their follow-ups. And we'll begin in our next video with our behavioral group.